Hello friends, in this video we are going to discuss about an ECG case. Here a middle-aged patient with chest pain and diaphoresis. So comment on the ECG that is given below. So in any ECG you have to, after seeing standardization and all, you have to see the rhythm. So let's check the rhythm in this ECG. There is P wave and QRS, T wave. P wave followed by QRS followed by T wave, and the rhythm is regular. RR interval is same. RR interval is regular. So it is sinus rhythm. Sinus rhythm. After knowing the rhythm, you have to calculate the rate. Since it is regular rhythm, we have to calculate the rate by 300 divided by number of large boxes between two R waves. So here, how many boxes are there? So let's see. 1, 2, 3. So 3.5. 1, 2, 3, 3.5. So 3.5 boxes are there. Let's say 300 divided by 3.5. It comes around 85, 86. So 85 bits per minute. So now we have to calculate the axis. Axis is calculated by seeing the lead 1 and lead AVF. So in lead 1, QRS is predominantly upward, and in lead AVF it is predominantly upward. So it is normal axis. Next we have to see waves and intervals and segments. P waves looks normal here. All the P waves are looking normal, and PR interval is also okay. And so look at what happened here. ST segment is elevated in lead 2, lead 3 and lead AVF. So there is ST elevation in lead 2, 3 and AVF. So this suggests inferior wall MI. Inferior wall MI. And there is reciprocal ST depression in lead 1, lead AVL and lead V6. So reciprocal ST depression in lead 1 AVL and V6. There is reciprocal ST depression in 1 AVL and V6. So this is again suggestive of inferior wall MI. And look at here. One more interesting feature is, see, there is this ST elevation in lead 3. So the magnitude of ST elevation in lead 3 is more than the magnitude of ST elevation in lead 2. Lead 2 ST elevation is less compared to lead 3. So in lead 3, ST elevation in lead 3 is more than compared to lead 2. And there is, see what happened, one more thing. In lead 1 there is ST elevation, and lead 2 also there is ST elevation. So in lead 1 ST elevation means it is suggestive of these 2 points. ST elevation more in lead 3 compared to lead 2, and ST elevation in V1. These 2 points suggest right ventricular involvement. So whenever there is inferior wall MI, 40% of the inferior wall MI are accompanied by, are associated with right ventricular infarction. So how to know that right ventricular is involved or not? You have to see for these criteria. ST elevation more in lead 3 compared to lead 2, and ST elevation in V1. So these are V1 and V2. These are suggestive of right ventricular involvement. And the right involvement of right ventricular is confirmed by right-sided ECG leads. ST elevation in right-sided ECG leads. So one important thing in this patient is you should not give, because whenever the patients involve inferior wall MI with right ventricular involvement, they are preload sensitive. So you should not give nitrates. Avoid nitrates, because when you give nitrates, patients will develop hypertension rapidly. So hope you got this message, and hope you like this video. Thank you.